Good afternoon, everyone, and thank you for joining us for What's the Economy Got to Do with It? The business case for state investment in early childhood in Wisconsin. I'm Ruth Schmidt. I'm the Executive Director at Wisconsin Early Childhood Association. We are co-hosting this webinar this afternoon on behalf of Raising Wisconsin. Raising Wisconsin is the advocacy initiative of Wisconsin Early Childhood Association and includes partners from a broad swath of sectors across the state of Wisconsin in advocating for investments in early care and education for our youngest children and working families across our state. I want to open today by saying just a little bit about Wisconsin Early Childhood Association. We're the largest single provider of services to child care programs and individuals that work in early care and education in the state of Wisconsin. We have staff that work throughout the entire state and provide services to all 72 counties, including supports for higher education attainment, stipends for people in the workforce, business supports for people operating childcare programs, and supports in starting childcare programs across the state of Wisconsin. Wisconsin Early Childhood Association has been around since the 1970s. We have dug in deeply into the issue of policy and budget impact in Wisconsin on early care and education with launching of Raising Wisconsin. Today, we're here to hear from some esteemed business leaders in our state to talk about what is the need for a state investment into our child care infrastructure in the state of Wisconsin. Next slide, please, Cassie. Thank you. So the child care challenge in Wisconsin has broad economic implications across our state. According to the Bipartisan Policy Center, the economic impact of the current crisis in child care in Wisconsin totals somewhere between $4.2 and $6.4 billion. This is in lost wages, lost productivity in our businesses, lost tax base in our economy. Next slide. And child care challenges then create significant challenges for the workforce in Wisconsin. We know that Wisconsin exceeds the national average for children, young children in our state with working mothers. The national average for moms of young children, infants and toddlers, to be working outside of the home is 62%. In Wisconsin, 68% of our youngest children have moms in the workforce. Many of them have both parents, all available parents in the workforce. And so when we have childcare challenges in terms of accessibility, affordability, we see that parents are less reliable and less effective employees if they are struggling with childcare challenges themselves. In some cases, they are forced to drop out of the workforce entirely. We know this impacts businesses and their abilities to hire, to be productive, and for us to have livable communities in our state. Next slide. We know in Wisconsin about 4 out of 5 employers say that they recognize that our state economy is impacted by parents' access to affordable, high-quality childcare. They understand that this is something that we need to address as business owners, as people in economic development and workforce development in our state. 2/3 say that childcare is one way for them to retain valued employees. But when we have a crisis in cost of care and availability of care in our state, it is very challenging for businesses to step in and figure out methods and mechanisms to address this challenge that we face in our state. Next slide. So why is there this ripple effect on the workforce of Wisconsin and on the economy of our state? What is it about childcare that's creating this ripple effect? Next slide. What we know is that for the average family with one infant, they are spending close to 20% of their household income on childcare to care for one infant. This is based on median household income. We know that when families have an infant and an older child in the home, they are often spending upwards of 30% of their household income in securing care for their children. And that is if they can even find care in their communities. Wisconsin is marked as a state with an incredibly high rate of childcare deserts. What this means is that in rural Wisconsin, 70% of our zip codes in rural Wisconsin have more than 3 children under the age of 5 for every single available slot of care in their community. Obviously, it doesn't take much to do the math to see that we have an incredible shortage of childcare slots available to families throughout the state of Wisconsin. Next. And so the childcare workforce, of course, is another reason why we have some of the challenges that we have in childcare. 80% of the Wisconsin childcare workforce has education outside of high school. Over 50% have at least an associate's degree or better. And yet, on average, based on recent studies in Wisconsin, the average hourly rate for someone working in childcare is between $11 and $13 an hour. And for a woman who's providing care outside of her home as a regulated family childcare program, that number drops to about $7.50 an hour. They rarely have access to benefits that most of us take as standard, such as health insurance. And many people who work in this field are accessing public assistance because childcare simply doesn't have the revenue influx to sustain a workforce with livable wages. This leads to an exceptionally high turnover rate in the childcare workforce in excess of 40%, again, creating this crisis of not being able to staff our childcare programs and operate in all counties of the state. Next. So the childcare business, we call it a broken business model. What we see is that parents are paying fees that are astronomically high in some cases, yet childcare programs operate on razor-thin margins. They are collecting fees that have to cover all staff salaries, rent, utilities, food, other operating expenses that are critical to a childcare program. And so as a result, childcare programs have a tendency to have to compress their wages. They compress their wages because that's the only point of control that they often have within their budget. Again, creating this really challenging situation of not being able to pay livable wages to people in this workforce, creating a shortage of childcare, creating a lack of access for working families and for our businesses. Next. So with the damaging effects that the pandemic had, public funding for childcare has been a lifeline. Next slide, please. Over the past 2.5 years, we have seen an influx of close to $800 million in federal revenue into childcare in Wisconsin. One piece that I want to point out to you, we'll not talk about it in depth, but Wisconsin really quickly activated a program called Child Care Counts as a way to streamline getting the federal COVID relief dollars out the door into the pockets of childcare programs so that they could keep their doors open. They could reduce their cost of care to families, especially families of essential workers, and they could continue to pay their staff when their revenues were woefully low during the pandemic. Next slide. You can see here, even with the most recent passage of the ARPA funding, that was an additional $112 million put into childcare counts. And I want to point out through this entire process, whenever public funding coming from the feds to Wisconsin for childcare went out the door, it went out the door with full approval from our Joint Finance Committee. So this is a very deep bipartisan issue in Wisconsin in terms of how do we solve our childcare challenges. Next. Most of our COVID funding is going to expire in January of 2024 with a loss of approximately $200 million a year in revenue that is currently going out the door into child care programs. Next. And so we believe we need a strong state investment in child care, and we believe that there are business partners out there that agree to this issue and believe also that this is impacting their businesses. So today, we've put together a slate of CEOs from across the state. Our panel for this afternoon's session is Chris Hardy. Chris has been the CEO of Seven Rivers Alliance, a La Crosse-based economic development organization. for the past 5 years. Prior to that, he was the executive director of the Black River Area Chamber of Commerce in Jackson County. And prior to that, he had 30 years working in the newspaper industry as a reporter, editor, and publisher. So I'm going to turn this over now to Chris Hardy and welcome him to continue this dialogue with our esteemed CEOs from across the state.
Thank you, Ruth. Appreciate the opportunity to be here today and to talk about this really, really important topic. So we became interested, the Seven Rivers Alliance became interested in childcare back in 2017 when we engaged a very comprehensive workforce development plan. We wanted to look at the root causes as to why our region was short on workers. So we did a very deep dive and concluded that our region faced three main challenges that were keeping workers out of our workforce, and that's housing, transportation, and childcare. Now, bear in mind, this is in 2017. So we started to partner with local groups, local agencies. We started to do some surveys because we wanted to find out what the cause of the implications of not having available childcare. So, for example, in La Crosse County, in 1998, there were 450 childcare businesses, and by 2019, that had dropped to 100, and last year it was down to 92. So we also partnered with our folks in Jackson County. They had a childcare center close, and really we brought together a community coalition, and we started talking about, we surveyed both workers and employers to find out what was going on, which we did in La Crosse County as well. So what we found out in La Crosse County is that 25% of the workers who responded to the survey said they spent between 2 and 5 hours per month dealing with childcare issues at work. So the economic impact of that in terms of just lost productivity is between $936,000 to $2.3 million a year in diminished or lost productivity. When we have people who are supposed to be focusing on their work having to deal with childcare. We also looked at that same survey in Jackson County, and we have a lost productivity of $2.5 million annually in Jackson County. Across the river, I know we're talking about Wisconsin, but I also represent Winona County in Minnesota. They did a survey, and 30% of the parents said they identified a lack of childcare as the reason that they had to decline work. And 75% of the employers say that a lack of childcare access leads to worker absences. 55% say it leads to tardiness, and 48% says it leads to no overtime. So the challenge here, okay, so why should businesses be concerned about this? Well, it's lost productivity, but it's also that even today we have more than 200,000 jobs in Wisconsin that are going unfilled. And a great challenge is that we cannot provide enough childcare so that our workers can go after jobs. We have a great number of people who are sitting on the sidelines, basically being idle or being underemployed because they can't find childcare. But I want to today talk to and talk with our great team of panelists here today, because they can talk firsthand about the impact that this has had on their business, why they're concerned about childcare, and some possible solutions. So I'd like to introduce our panel today. First, we have Sachin Shivararam, is the CEO of the Wisconsin Aluminum Foundry, a century-old family-owned manufacturer in Manitowoc. Sachin has spent his entire career in the metals industry, holding roles in sales and strategy. He has a BA in history and literature from Harvard University and a master's of philosophy in social and political sciences from the University of Cambridge. We also have Dan Rohrbach, who is the CEO of Southwest Health in Platteville and has more than 25 years in leadership roles in rural healthcare organizations. And I know he comes from good stock because he grew up on a dairy farm like I did, but this was in North Dakota. So, but that's okay. We won't hold that against you. His undergraduate degree is from Valley State University, and he has a master's in management from the University of St. Scholastica in Duluth, Minnesota. And we have Paul Scharfman, who is the president of Specialty Cheese in Reeseville. He and his wife founded the company in 1991. Paul's a Harvard Business School graduate and is a former Oscar Mayer marketing manager who has made it his goal to reduce rural poverty by eliminating barriers to employment. So those are our panelists, and I'm going to begin with some questions here. So Sachin, let's start with you. Your company has taken a very proactive approach to the childcare crisis, even providing childcare payments to your employees. What happened to make you want to take this approach?
Sure. Thank you, Chris. And just wanted to say to Ruth and the team, what a pleasure to be here and to know about what WECA is doing, and bringing together this kind of group of like-minded people to tackle this issue. So, for me, I was blissfully unaware of childcare problems. I have 2 children of my own. My wife and I have 2 boys, 5 and 9 years old. But we have childcare centers, and it was never really an issue. And one day I was talking to an employee of ours in the parking lot, and in the back seat of his car, I saw a pink car seat, and then it was just surrounded by Mountain Dew bottles and Dorito wrappers and just garbage. And I just I looked at it, and I just instinctively just asked the guy, "So what do you do for childcare?" Thinking about this child, and he said, "Well, I have a daughter. He's a single dad, has a daughter who's 3 years old, and he takes her to a different home every single day, friend, an aunt, a grandma, whatever. And that's how she's cared for." And honestly, it just broke my heart, to think about this little girl, backpack and toothbrush in tow, going to different homes where I'm sure people, love her and care for her. But certainly she was not getting the type of engagement that she would get at a early childhood education center. I myself, my parents taught me to read when I was young, when I was 3 and 4, and that really helped me throughout my life, and I value that. And so I thought about her, and I thought about she can't possibly be getting those sorts of opportunities. And so it got me to thinking about what other of our employees are in this situation and their children, and what can we do for them. And really, the thing that you and Ruth emphasized in the beginning about availability of workers and helping make work and life sustainable was actually kind of the second concern. Obviously, that's a big concern for us. We're a growing company. We have about 750 employees, and we really depend on having an adequate labor force. But primarily for us, it was about this human aspect of how are we caring for children in those precious early years in their childhood. So I started learning about childcare, what the ecosystem looks like, what does it take to educate a child? And our first initiative was to actually create a center of our own. And so we hired some people, some experts, and we put together a budget. And we tallied up all the expenses, and we said, well, we want good student teacher ratios, we want good facilities, we want play areas, all that stuff. And then the bill it came up to about $40,000 per child, and which is insane, and it's not something that our employees could pay, that we could subsidize. It was just a non-starter. And that, that hitting a roadblock early got us down this path of trying to help figure out a solution in our community, and which led us to experiment with a number of different things. But as you mentioned, kind of what we're doing now is we pay $400 a month to our employees to offset some of the expenses that they have related to childcare, as well as we participate in the Partner Up program through the state of Wisconsin.
Thank you, Sachin. So Dan, you have helped pull together a group of community partners to seek a childcare solution. Can you tell us how you did that and who those partners are, and why did you feel that was important?
Sure. Thanks, Chris, for having me on, and Ruth for this opportunity to talk about this as well. So maybe just to take a smaller step back and say, growing up on a dairy farm in North Dakota and then becoming a healthcare executive, when would I ever have to worry about childcare? Besides, like what Sachin said, my own kids. And my own kids now are grown and gone. So it's not a personal issue anymore. But over the last handful of years, it's really become an organizational issue. And one of the number one questions I get from my team and my staff is, at what point is Southwest going to be, providing childcare services? Because it's getting that difficult to recruit and keep staff when they need those services. So I was at a meeting at the university here, University of Wisconsin-Platteville. I was promoted by Workforce Development Group out of Madison. And we were talking about workforce issues and where can we find more workers? What are the barriers? And the number one thing that kept coming up over and over and over again was childcare. Housing was the second one, but childcare was number one. And so, there's a lot of discussion that happened that day, but also then it's like, okay, who's going to take this to the next level? How do you turn these discussions into actually actionable items that we can move forward and try to solve these problems? And so I reached out to some of my colleagues at Southwest Tech, University of Wisconsin-Platteville, the school district here in town, and then some of the key business leaders and said, hey, let's get together, have coffee, and just talk some more about this and figure out, is there a solution that we can do as our community? Because this is something that I think we're going to have to fix on our own. And so we pulled that group together. We had multiple meetings and we started looking for opportunities for funding. What we came up with was really looking at a business model that if we could find the funding to build a childcare center, to actually build a facility, that the businesses would participate, financially by guaranteeing spots that would fill those. You'd always know that would be 100% occupied because the businesses would backfill that, and we would financially support it. But we needed the capital to get it off the ground. And so over the last 18 months, 2 years or so now, we've been working on different grant programs and different opportunities, trying to find the funding to get the building done. We have acreage here next to the hospital that we can build a childcare facility on. The university, the partnership looks a little bit like this. The university would actually run the childcare center. We would build it, lease it to them. They would run it. Southwest Tech would provide workers because they have an early childhood development program. And then we'd work with the school district on after school programs and those types of things. So we've got it all worked out. We have a pretty good idea on how it would function. We just need funding and to get it off the ground. And I think it can be, sustainable with the businesses that have made commitments to us to get this rolling. So, we're excited about that opportunity. We just got to get that initial seed money to get it going. And that's just one approach we've taken. There's multiple approaches to tackle this issue, but we're seeing a massive workforce shortage in the state of Wisconsin on the healthcare side, and I know just in general. So I think businesses now are acutely aware that they have to be part of the solution, but it can't just be the businesses. It has to be the community. It has to be the state. It has to be our legislators. That's everybody on the same table saying, hey, here's solutions. Let's all pitch in a little bit and make this happen. So I'm happy to be part of the panel and discuss these things and look for opportunities, because childcare is not my thing by any means. But I know we have to be part of that solution in order for us to keep workforce in our hospitals to be able to do what I do know, which is providing healthcare services.
Thank you, Dan. So I want to turn toward Paul. Speaking of somebody who seeks solutions, when it comes to being innovative to getting workers in rural Wisconsin, you're all in. You even provide your employees with transportation assistance. Why is childcare your next target, Paul?
I'd like to say it's because I'm a nice guy. I hope that's true, but that's not why. Our company has been very fortunate. We've grown by more than a factor of 10. I need people. We're a manufacturer, but our most valuable assets are not the piece of equipment. It's the people who can adapt to change. The problem is that in rural areas that we're in, and I believe throughout the state, rural populations are declining. And the prospects are not for reversal, but for acceleration of the decline. I build walls and buildings with a 50-year life. The workforce of 10, 20, and 50 years from now looks adverse. So we went out and we did a survey in our county of those households where there is an adult who isn't working. And we asked how many households have an adult who's not working, who would like to work? And the answer was startlingly high. Almost a quarter of the households in the county had an adult living at home who wasn't working but wanted to work. Okay, that's a lot. What are the barriers to work? You mentioned, Chris, that you did a survey. we did a similar survey. We found a little different answers. The biggest issue is health. The second biggest was transportation. The third biggest was childcare, and the fourth biggest was housing, affordable housing. So health, we brought in a physical therapist, and we have a full-time physical therapist, and we have emotional counseling as well. That actually helps retain and bring in workers. The second biggest is transportation. In case anybody didn't know, it takes a long time and a lot of money to drive around rural Wisconsin. The roads are good, but it ain't cheap. So we put in a program where I hire people, they work 24 hours a day, 7 days a week, to drive to my employee's door and carpool them to their shift, pick them up at the end of the shift and bring them home. And if anybody gets in trouble during the day and needs to get back, the drivers will bring them. Oh, Paul, it's terribly expensive. $20 per person per day. That's a lot of money. Yeah, but I got the people I need. And what's more, my factory of several hundred people is fully staffed. No other factory within 50 miles is fully staffed. Why? Because I'm giving people rides. We get people who call us all the time. We're looking for a job. You're the company that gives rides? Yeah. What do you make? They don't know that we make cheese. They don't care. We're going to take care of our people. So we're offering rides. Good. We're doing something about people's health and wellness. Good. What's next? Third biggest barrier is childcare. So the Dodge County Housing Authority has won grants to put on my land adjacent to my factory affordable housing and a childcare facility that should be available occupancy in roughly 12 months. It'll be built. If Dan doesn't know much about running a childcare center, I know less, but it's going to happen, and we're going to fund it to the extent that we fund our rideshare program. Will it work? Will it be good for the community? Yeah, it will be. I hope that answers your question. Thank you so much, Dan and Ruth. Chris and Ruth, excuse me.
Thank you, Paul. So, Sasha, and I want to circle back with you because when we were talking prior to this meeting, you mentioned that you have a strong belief in free enterprise and market solutions. Why have you come to the conclusion that we need a major public investment in childcare?
Yeah, I mean, this was important, when we discussed it, as you mentioned before the call, because personally, I mean, I certainly don't want to, advocate for permanent life support for childcare. I think that's something that our, state can't afford, and it's fundamentally probably not healthy for the economy. We want these things to exist on their own. But what our experience taught us in trying to get a childcare center started was the costs of what the child really needs, amount to something that the market today can't afford. And generally we think of those as kind of market breakdowns, where the cost of a good is just out of reach. But usually the economy, resolves that over time. Housing is a classic example. Yes, in many places it's unaffordable, but the unaffordability itself brings down prices or creates alternative solutions, and then people can get along. But here there's a real market breakdown where I think state intervention is needed for two reasons. One is because, we need employees, we need workers, we need a labor force now, and it's a real impediment to our economy, and we can't wait 5 or 10 years for the market to resolve this. But the other thing is, again, to get back to that human element, we can't have a generation of kids having, very suboptimal care that's going to, hurt them for the rest of their lives. Like, that's not a price that I think society should be willing to pay. And so we need state intervention to help resolve this market problem, and then get out of the way. And I think that can happen through successively reduced subsidies. For instance, in our community care center initiative, our plan is, over 6 years, we're phasing out the subsidy that employers are giving the center. And hopefully over 6 years, wages will go up, people can readjust, what they're paying for, and eventually they'll be able to afford the full bill. But today we can't make that transition happen without, some sort of easing into it. And that's why I think that, it's perfectly compatible with a view of, having a free market economy, and also saying, well, for some time, we're going to need some intervention to help us get there.
All right, thank you. So, Dan, I want to start you off with this question, and I'd like all the panelists to then weigh in. We're focusing today on the need for the state to make a major investment in childcare. How do we get more businesses involved in this discussion, and what's the best approach for talking with our legislators?
Yeah, I think that's a great question, and I think it really takes local leadership, like folks you have on this call today, to really take this as an initiative to say we need to lead these discussions at our local level, and that's what we've done here in Southwest Wisconsin and Platteville specifically. When you have the largest employer, well, the second largest employer, I guess university is a little bit bigger than we are, but when they step up and say, hey, come out, let's have coffee, let's talk about this. They're going to show up because this is a major issue for every single one of them. I don't think any single entity, including us, has the ability to fix this on our own. We just, it's not necessarily our sweet spot. And I think the legislators probably are in the same boat. And to Sachin's point, we need a long-term solution, not just we just need handouts to make this work. And I think that's a challenge. But I think the legislators are going to start hearing more and more about this. I think over the last couple of years, this problem has really accelerated with the pandemic. Has really brought this to the forefront, and everybody has been dealing with so much of that. They haven't really thought about the causes of what's actually causing the lack of workforce. And to Paul's point, some of the statistics he shared, 25% of the workforce or so households having people that want to work but can't for whatever reason. The businesses have to step up and be part of that solution. I think what I find when I talk to partners in my community is they want to be at the table. They want to be part of the solution. They want to be there. It's just they need guidance. They need leadership, and we need this private public partnership to get this thing rolling forward. And when you talk about what this will do for our state, I mean, from an economy standpoint, we're sitting in a pretty good spot. We weathered the storm pretty well. This would be a good time to make sure we don't see ourselves fall off. Because we can't get workforce because they have to stay home and take care of the children versus having them go to a childcare center. So I think the short answer to that long answer I just blurted out was you need local leadership.
Okay, thanks, Dan. Paul, what do you think businesses need to do to get their legislatures involved in this discussion?
It's a twofer. I think the businesses need to explain to our legislators that workforce matters. I get grants and funding from old government programs, which are based on, we'll loan you money if you create new jobs. No, we want the opposite now. We need workers more than we want to create new jobs. And often our legislators are a little behind that curve. We need to explain workforce development is our top priority. So how do you develop a workforce? Training is part of it. Getting people here is part of it, attracting them to the state, and releasing the potential of our current population. Childcare being high among those initiatives is another. Chris, I believe there's a potential for the legislature of this state to declare this state is the most family friendly in the nation. That's a carrot. It's not just responding to the needs of the business. It's being proactive and declaring we're the ones that you young people around the country should be moving to, because we're going to help you. We're going to provide you incentives for building and growing a family. I think that is not a partisan message. I think that's a unifying message that both sides of the aisle would come together, and we businesses would help them. I hope it helps.
Thank you, Paul. Yeah, I think it's the we're talking about the fundamental challenge of providing childcare, but underlying, we need to attract more families and more workers to come to Wisconsin. So the two can certainly go together. Sachin, what are your thoughts on this topic?
Yeah, I think we need to get people out there and talking to parents who are engaged in this struggle every single day. And I think, a lot of us, I'll put myself in that camp, are somehow removed from that struggle, because either we don't have children, of childcare age, or we had the solution figured out because we can afford it. And I'm really dismayed at the lack of awareness amongst our peers about this problem. As we were preparing for this call, one of you mentioned you were with legislators and other business people who said, I just don't hear it. I don't hear that childcare is a problem. And when I heard someone say that, I thought you must be living under a rock, because this is such a giant issue for the people who are working at our companies, that, we just need to get engaged with them.
I think what we found too in some of the surveys that we've done is it depends on who at the company you're talking to. Sometimes the corner office CEO may not be quite as in tune with their workforce as the floor leaders are, and they certainly can understand some of those challenges. I think sometimes they're advocating for their workers and helping them when there's a childcare emergency at home, and sometimes that information may not trickle up to the top. So another question, and Paul, we'll start with you. How is childcare connected to rural revitalization in Wisconsin? And you're certainly part of that effort.
Oh man, as background, everybody should understand that 20 years ago, Reeseville was the home of a thriving high school, junior high, and grade school. At about that time, population declines led the county to say, we can't afford to have that many schools in the county. So the Reeseville school closed. By the way, I bought it and turned it into a growing cheese factory, but my office is in the detention center. But there's no child care, there's no schools. So we suffered in Reeseville a population exodus, plummeting property values. Who would want to move to a place where there was no school and that was a long bus ride? That writ small is the story of rural America writ large. Until we can make it a family-friendly place, a reasonable person's incentivized to leave. Why would I want to start a family when to get my kid to school is a 15-mile drive, winter, snow, summer, or fall? We need to help the population return to rural America with jobs, but with family-friendly support. Childcare being at the top of that list. I hope that helps.
Okay, Sachin, your thoughts?
Yeah, on revitalizing rural America, I mean, this is one of the key problems why people don't live in the, all of our factories are in small towns of 20,000 people or less, sometimes 5,000, and lack of availability of big city resources like childcare is number one reason why people don't live there. So agree with Paul. Fundamentally, this is related to that. And if I can, while I have the mic here a little bit, if I can address a couple other points that one that I saw pop up on the Q&A, and a couple other things I want to make. One is so we have a policy of we give $400 a month to our employees to pay for their childcare expenses. Initially, we did this and said, bring us a receipt from a licensed childcare provider and you'll get your $400. And then we realized that people weren't bringing us receipts because they couldn't find licensed childcare centers. There's just a huge lack of that. And so that's why they're opting for this informal care. And now, we pay for informal care too, because we understand that people can't find it. But that lack of licensed care centers was very eye-opening for me. The second was, I was touring a beautiful childcare center in Whitelaw, Wisconsin, where many of our employees go. a few months ago, and the first words out of the mouth of the woman who runs this, a dynamic lady who had a career shift and bought a childcare center, is doing a wonderful job. She said that, the state funding that she had gotten over the past couple of years was keeping them afloat, and she mentioned the cliff in 2024 that's going to happen that Ruth mentioned. And internally, I'm thinking like if the funding runs dry, that one childcare center in Whitelaw, Wisconsin, population 800 or 700, whatever it is going to shut down, and that goes back to what you and Paul were talking about. Third point I wanted to make is there's an interesting question that popped up and it's from Katie Roberts, and she asked, how can Wisconsin businesses help with messaging that childcare is community care and childcare workers are professional educators, not just women? Thought that was just a beautiful point, because the stereotype of childcare is, it's a bunch of women changing diapers, and that's what it is, and actually these are educators who are molding our children in the most formative years of their lives and doing, real yeoman's work there that has lifelong impact on job outcomes, on education, on inequality. And so 100% agree that, people need to be educated on what these educators are doing to truly value that profession.
Dan, you are involved in certainly another rural part of the state and rural healthcare. So how do you feel what role childcare has in revitalizing rural Wisconsin?
I think maybe a little selfishly, when you're, we look at rural communities, what's a lot of times the health of that community or the economic growth of that community, those sorts of things, is based around the healthcare system that's there. If you got a really robust healthcare system, a good hospital, good clinics, you can build around that. Well, if those rural hospitals, those clinics, those areas can't recruit workforce, you don't have that. People aren't going to move to a community without healthcare services that are either in the community or very near the community. So when we recruit physicians, medical staff, and then the staff that support them, one of the biggest questions is what's the childcare look like? Well, if you can't recruit to that and you can't grow your healthcare system, you're not going to grow your community. So I think it's extremely important in rural, and that's all I know, to be honest with you, Chris. I'm a rural guy. I don't know how it works necessarily in the metro areas as much as I do in the rurals, but I know in the rurals it is absolutely critical.
Okay, thanks, Dan. So there's no one size fits all solution to fixing childcare. We know that. But if I'm a business owner that's listening today, what suggestions do you have about getting the start to understanding the challenges in my community? And Dan, we'll start with you.
Well, I probably addressed this a little bit before, is just, getting out there and talking with folks about it, knowing that, and then spreading that word to, through your local chambers, through your other civic groups that you have, and then getting your legislators involved. I know, from a business leader standpoint, the legislators in my district are at my beck and call. If I call them and say, hey, I need to talk to you about an issue, they'll be here. And so I think we need to take the lead on those things. And to Paul's point, what he mentioned earlier is when they don't hear about an issue, they got plenty of issues they hear about. And so if we're not talking to them about the concerns that we're having as business leaders and as communities, they're not necessarily going to either hear about it, or they're just not going to put it on the forefront. So we have to be pulling those folks in and having these discussions and coming up with long-term solutions for this problem.
Sachin, your thoughts on how businesses can start that conversation?
And one of the things that Ruth counseled us on as we were preparing for this thing was, she was like, you don't need to get too much into the legislation part of it. And I was relieved when she said that, because frankly, I don't understand a lot of the stuff. And in business, in our business, we make aluminum castings, and that's all I really know about in life. But what I think we can do as businesses is tell stories. We are smart enough to at least understand the stories of the people we interact with. And I've seen that among political people, stories make a difference. And I think the more we can communicate those, write about those individual people, that we can really do that. It would make a huge difference by conveying those stories.
And Paul.
Short-term, long-term, your local business, you want to start thinking about providing childcare for your employees. Short-term, job one, ask, is there any provider anywhere near you? In my area, the answer is no. So if I want to help, I can spend all the money in the world. There's nothing available. If that's true, go to step 2. It's a long-term haul. You want to go start your own childcare center? Hang on, you need help. And what I find is that increasingly other businesses are coming to step 2. If there is some childcare available, there's no extra available, there's no more capacity, and there's 0 off shift. So we have all too many people who are a married couple working for us, and they need to work an adjacent shift so that dad can take the kid, drive to work off shift, mom can leave first shift, and the child stays in the vehicle. There's a switcheroo. There is no option of childcare. We need help. Society needs help. If we try to approach the legislature on this basis, we have a chance. We need help because businesses need help. If we go to the legislature and say, we need help because no child ought to suffer this, it's heartrending, but it won't move the needle. Explain why your business needs help, and all of us collectively as businesses have a chance of improving society.
Okay, thank you, Paul. So we want to make sure that we're addressing some of the questions, and I know that a couple came up in the Q&A. Cassie's been monitoring the questions. Any questions for our panelists that they can help answer?
So Chris, I think at this point we'd welcome any other questions, and we'll try to get what we can, get to what we can in the last couple minutes before we do our last part. So anyone that has any further would be great. Would we first though be able to just expand a little bit more about Partner Up? I know that Sachin did address talking about that, but just from anyone else's perspective, what we can share about Partner Up and its role, the role that it's been playing.
Helps us. We have half a dozen people who use it. Small, but it helps.
Okay.
I just say that, you know, the thing that as I mentioned in the Q&A, that I like about Partner Up is that it pays the true cost of care. And from what I understand from a lot of childcare providers, you know, other subsidy programs, or, you know, whatever they're getting from their families who are participating, you know, are paying rates that don't meet the true cost of care. And so they're fundamentally not sustainable without that. So that's what I think Partner Up has really done a good job of.
Okay. As we wait for some other questions, I want to throw this one out there because I've heard this from businesses. Sachin and Paul, you both provide your employees with some childcare subsidies. How do you respond to businesses that say, well, I need to be fair to all my workers, so, you know, I can't give money to those workers with children and not be fair to the rest of my employees?
Paul, okay, I guess I'll go first on that one. You know, thankfully, we have not had that complaint from employees. The messaging we've done around the program is, you know, our fellow employees need help, you know, and some people use health insurance more, you know, some people use other benefits that we have more. And this is one of those things where people need help. But the solution that I would prefer to avoid this problem altogether is one, you know, where we're paying into a system, you know, either a community healthcare center or a community childcare center, something like that, where, you know, the benefit is then disguised. You know, it's because it goes to the center itself. And then if businesses want to, you know, allot certain spots in the childcare center to employees, then that's different than actually a cash payment. And so I think that helps kind of avoid the problem.
Okay, Paul?
Two parts. The first part is my subsidy for childcare is equal to my subsidy for rideshare. So if you use rideshare, you aren't going to be able to use childcare because I won't give the ride to your child. But if you aren't going to use rideshare, you can drive and the childcare center will be next door, and I'll subsidize the child as much as I would subsidize the ride. Somebody says to me, I don't want to do either one. I say, fine, it's available. You want to drive to work? That's up to you. But you could be using that $20 a day. You're turning it away. The person with a kid at home can't use it, so they get it. It's fair. You're turning away $20 a day.
Dan, you haven't started a childcare center yet, but have you had any thoughts on this topic?
Yeah, we actually had a lot of discussion with our businesses. Exactly what Session had said is that's how we were going to structure it. We basically would support the childcare center by guaranteeing spots and guaranteeing funding. And then because we're doing that, they would be able to then turn around instead of, whatever it is, instead of $5 an hour per kid, it ends up being $250 for the kid because you're a Southwest Health employee and they are, a sponsor of this program. So that's how we looked at structuring it. To kind of get back to that equality question is again, I think the point of the session is probably a very good one, that I'm not sure their coworkers care. They understand if their kids have already gone through it, like mine, you understand the challenges that brought, and if an organization is going to support that, that's a great thing. If I have kids coming and I know the organization supports that, that's a great thing. So I don't think that there would be a lot of that, but you do get away with that if you can partner with somebody. In our case, it would be building one and then supporting it. Or if there's one built already, to support that business through guaranteed spots is I think probably the best way to go from a business standpoint.
Okay. All right.
Chris, I think we have one more perhaps that we could get to. So thinking about how we advocate for state investment, what strategies do we use to reach legislators? This person is, saying that they've heard of, others doing pretty strong advocacy in other states. So to kind of circle back to what we heard before, what strategies do we use to reach legislators and really have our messages be heard?
Okay, thoughts, gentlemen, on strategies to really have an impact and to reach our legislators.
Yeah, I work with legislators frequently. And the overwhelming first thing is tell them it matters. Whether you're a child care provider, a parent, or whatever, tell them it's a big deal. It is my opinion that when businesses speak, the message is amplified. Whether that's right or wrong, but that's the way that the capital tends to work. So to the extent businesses can say, we have a childcare issue, we'd like the state to help. Don't write the policy. Don't prescribe to them how they're going to help. Just say, we're businesses and workforce is a real problem. There are really smart people who can't get to work because of childcare. Can you please help us? As a collective, the legislature will figure out a way to help us.
Okay.
To connect this to one of the other questions that, one of the other questions that popped up from, I believe it was Manami. She said, this is an all-male panel. How do you feel about your role as a man in this fight? And I think, Ruth and the team deliberately, set up a panel of men to engage, to help this, engagement of legislators to make clear that it's not a women's issue. This is a family issue, and we're all in families. And so having, a diverse set of people who are advocating for this issue is a great way to engage legislators. In this case, our panel is not diverse on purpose, because the rest of the people doing the work advocating are mostly women.
Dan, any thoughts on that?
Probably just a cause and effect. When I visit with our legislators, almost always it's about healthcare related issues and talking directly to them about the struggles we have in healthcare and some of the policy changes we want to see on the healthcare sector, and usually don't relate it back to a secondary issue, which is like workforce. Okay, well, what's the cause of not having workforce? And so I think it's really just taking that conversation to the next level of not just advocating on my side from the healthcare standpoint, but also talking about if we don't have a workforce, we don't have a healthcare. We don't even need to have those conversations about healthcare policy if we don't have a workforce. And so I think it's just taking that conversation to the next level with our legislators. And I think to Paul's point, you know, when we talk to our legislators from a business standpoint, they listen. If I bring up a personal political view, that kind of stuff, well, then we just chat, you know, but when you're actually talking about issues you're having as a business, that's when the legislators really become engaged and are willing to, you know, work with us on solutions.
All right. I think that's a great segue to our closing here. And so we're going to bring Ruth back in to kind of help close us out today.
Thank you, Chris and Paul and Sachin and Dan. This was a remarkably rich conversation, and I appreciate the time that all of you put into preparing for today and being here to present with us. Sachin, you stated that all you know about is aluminum casting, and I think we all learned that that's just not a true statement today. Your insights were really valued. Paul, the work that you do face-to-face with legislators is just important to all of us, and there's a lesson for us to learn in that. Dan, your commitment to community and the pairings that you can make between your workforce and having a healthy community and supporting community engagement and how we do this is also just so critical to this. Chris, you're an ongoing leader in these conversations, and I just so value your willingness to help moderate today and the leadership that you show on this issue in your own communities. I did want to let people know as we close out today, and Cassie, if you want to bring up the slide, the closing slide. Just to let folks know that this is the first in a series of webinars that we will be putting on through Raising Wisconsin, specifically with businesses and economic leaders in mind. I think today was great. I'm looking forward to the next two. The second one will be happening post-election. Look for this information to be coming out probably sometime in November. We will be talking about an election debrief and the impact that the election has on our childcare priorities in our state. The third event will be posed probably in January before the state budget is announced by whoever is governor at the time. And it will be an employer call to action. So lifting off of the things that were said today and how we engage businesses more deeply in this issue. Please take a moment, if you haven't, to sign up for Raising Wisconsin's Advocacy Digest e-newsletter. This is a great way to stay connected to this information. You can get to it at raisingwisconsin.org, and then you'll receive timely updates, including any information on webinar details. Again, thank you to the panelists and to Chris today for facilitating this conversation with us. And please do stay connected. This information has been recorded. This session has been recorded. It will be available for streaming on the Raising Wisconsin website. Thank you all again so much for joining us today.